Canadian Public Health Association is all about. Bear with me, there we go. So at the association, one key area of our work is to advocate for public health, speaking up for people and populations to all levels of government. We champion health equity, social justice, and evidence-informed decision-making. We leverage knowledge, identify and address emerging public health issues, and connect diverse communities of practice. We promote the public health perspective and evidence to government leaders and policy makers. And we act as a catalyst for change that improves health and well-being for all. Our vision is a healthy, just world, and our mission is to enhance the health of people in Canada and to contribute to a healthier and more equitable world. I also wanted to give you a quick overview of what we'll be working towards as we put in practice our strategic plan up until 2020. So by 2020, we hope to achieve the following: that CPHA is the national independent evidence-based voice for public health in Canada, that the CPHA represents the public health community's interest in public system renewal, that the CPHA is a convener of partners to identify solutions to public health issues, that we have a dynamic and engaged membership, that we're financially and organizationally resilient and sustainable, and that we inspire and motivate change in support of health equity. This webinar is part of a monthly series, and we hope you can join us for future sessions. We have a few more as part of this series. So I encourage you to stay tuned up until the very end for the link to register to the next session in February. And that session will be all about postdocs, how to find them, how to apply, how to prepare, etc., etc. So before we go on to our main event, a little bit of housekeeping. So how does this work? We hope to engage you throughout the webinar. So first, if you're on Twitter, feel free to tweet during the webinar using the hashtag CPHA webinar hashtag. I'll put that in the chat box. I see a question from Morgan. So we will share the recording for the webinar at a later date, and that will be emailed to you. So back to housekeeping. In terms of participation, or asking question rather, we encourage you to use the chat box and feel free to post your questions as they come to you throughout the presentation. I'll be collecting them and asking them during the Q&A portion, which will be at the end. And we encourage everyone to make their questions public so others can see it. And we'll attempt to answer all questions during the webinar. If we run out of time, we'll see if it's possible for us to answer them by email. And like I just mentioned, the webinar will also be available afterwards, so a recording will be posted on YouTube, and so you'll be able to view it there. So one last thing before I introduce today's speaker. The early bird registration for our conference will open in February, and we've received a record number of submissions this year, so you could really expect an especially high caliber of presenters at the conference in the spring. So if you sign up to our conference newsletter, you'll receive a notice when that opens, and you can take advantage of the early bird rates. And later today, we'll also be launching a call for submission to present at 2 forums that will be happening concurrently with Public Health 2018. One of them is focused on tobacco control, and one of them on vaccination and public health. So if you sign up to this newsletter, you can select the areas that interest you most. So there are different sub-newsletters, if you will. So I encourage you to sign up, and you'll receive those notices directly in your email. So enough about that. We'll now move on to the main event. So today I am honored to introduce our speaker, Dr. Suzanne Jackson. Dr. Jackson is editor-in-chief for Global Health Promotion. She's the head of the Global Health Promotion Consortium at the WHO Collaborating Center in Health Promotion and associate professor at the Dalla Lana School of Public Health at the University of Ottawa. She specializes in participatory health promotion planning and evaluation and global public health, as well as health promotion, education, and training. In Canada, she was the director for the Centre for Health Promotion for 9 years and provides technical support to the Canadian Best Practices portal in chronic disease prevention and health promotion. She has been president of the Ontario Public Health Association, and she is currently the president at the Canadian Public Health Association. So welcome, Dr. Jackson. I turn the mic over to you.
Okay. I'm waiting for my presentation to show. Great. Okay. Hello, everybody. I'm talking about the day in the life of a health promoter. Now, my life as a health promoter has involved various levels. So I'm really going to be talking about this from the point of view of a health promoter at all kinds of levels. But first, what I want to start with is that the hooks that I use to practice health promotion at any level starts from the Ottawa Charter definition of health promotion, the process of enabling people to increase control over and improve their health. From this definition, I get 5 hooks. One is that in order to enable people to increase control over their health, then I need to practice as a health promoter using participatory methods. I need to help people be part of the decisions that affect them at the individual, community, or societal level. When you talk to people about what affects their health, it's the conditions of life that make a difference to them, or the determinants of health. So that means that if I'm going to work with people to enable them to increase control over and improve their health, I need to work with them around the conditions of life that make a difference to their health. Health promotion is inherently a positive concept. So it's unlike disease prevention, which starts from the premise of disease. Health promotion starts from the premise of health. And that means that we're looking for the assets that people have, the assets that communities have, and not what they don't have. So we're not starting from problems and starting from the negative. We're starting from a positive stance. So that means we're looking for strengths, looking for the positive things that individuals and communities and whole societies bring to the situation, and that's part of our starting point. Because we're working in a participatory way, because we're focusing on determinants of health, because we're looking at assets and working with people in a variety of ways, that means we have to use multiple strategies at multiple levels, and we have to do all of this at the same time. One of the key things that we do as health promoters is try to change the context. One of the things that you try to do when you're working on determinants of health is that you're trying to change the conditions and the features that affect people's health, and that means we're changing the context. So from a research point of view and an evaluation point of view, this has been one of the big challenges in my life as for a large part of it, I've been a researcher and evaluator. I'm changing the context, and so I can't keep the context constant in my work, and that has always presented a challenge. At a more concrete level, to a certain extent, the kinds of strategies that are in the Ottawa Charter, those 5 basic strategies actually really work as 5 levels for me. One of them is building healthy public policy. That's the broadest policy level. Creating supportive environments, strengthening community action more at the community level, developing personal skills more at the individual level, and reorienting health services at the institutional level. These strategies are woven with those hooks that I those 5 hooks that I just talked about. Another way to look at of what health promoters do is to look at the skills that Health Promotion Canada has posted on their website. And these skills are really the bulk of them are all process-oriented skills. They're about using a population level approach, focusing on diversity and inclusiveness, conducting situational assessments, planning, evaluating, policy development, mobilizing communities, working collaboratively with partners, communicating health information, and providing leadership and building organizational capacity. You could have a position in an organization and do the bulk of these kinds of activities without having health promotion in your title. What makes these activities particularly health promotion oriented is applying those 5 hooks that I talked about earlier, using that using that participatory method, focusing on the upstream determinants of health, looking for assets, working in a variety of different ways, using a range of different skills and strategies at different levels. So that set of skills that's listed has a health promotion twist in it that makes it very particular to health promotion practice. So how many of you, I've got a poll here, how many of you have health promotion in your title? Okay, so it looks like about half do not have the health promotion in the title, but it doesn't mean that you don't do health promotion work. Okay, and then so often we're using health promotion concepts in your practice. As I pointed out in the previous slide, the many skills that are involved in health promotion can have a health promotion twist to them. How many of you work at these different levels of practice, the individual level, local level, provincial, national level, research, international, or it doesn't apply? So it looks like in this audience, we have about 1/3 of the audience are working at the local level. And then we have some provincial people, some research people, students, and some individual level people. I'm going to go through the different levels when I'm talking about this. Okay, so in health promotion practice, you could either have content expertise. In other words, there's some real components of upstream population health promotion type work that you bring forward as a policy analyst or developing particular programs as a health educator or a health communications person or an evaluator and researcher. Or you could be mainly a process-oriented person where your work is mainly in communities, doing community development work or developing partnerships and intersectoral, working across sectors, or facilitating a healthy settings work. You can see that that in health promotion there's a blending of these different components. In public health, I think of the key components of public health: prevention, protection, promotion of health. It's integrated across the entire public health unit. So the concept of focusing on the upstream determinants of health, the population level, intervening early in the life cycle, working in whole settings like schools or workplaces or other whole settings, using legislation or policy approaches, educating individuals and groups using a variety of different tools, and media communications are all part of health promotion practice in public health, whether you hold the title of health promoter or not. An example of this is some work that I did with the Pan American Health Organization. I think this was around 2006, about 12 years ago. They asked to mainstream health promotion across their entire organization. PAHO is like a giant public health unit in a sense, and they're operating across all of the Americas. They listed key generic activities that they have in all of their programs. So data collection and analysis, program planning, healthy public policy and legislation advocacy, strengthening knowledge for action, monitoring and evaluation. By now you'll see that these kinds of components appear over and over again when we're talking about health promotion. So the trick was to say, all right, all of you are doing those generic activities. What is the health promotion lens that you need to apply when you do those activities to put that health promotion twist in what you do? So thinking upstream, thinking about the determinants of health, whether you're working in communicable disease control or non-communicable disease control, or you're working in healthy municipalities in the Americas, that thinking upstream and looking at the determinants of health is an aspect of health promotion. And particularly focusing on a participatory approach, engaging people that you're working with at various levels in any decisions that you're preparing or any materials that you're preparing, doing community outreach and empowerment, using an asset-based approach, using a rights and equity-based approach, that you're connecting levels and partners, so you're not trying to work in one silo, even at one horizontal level, you're trying to connect them vertically and across sectors within one level, and you're using multiple strategies and settings. And this was how we were conceiving that health promotion could be mainstreamed in all of the components of PAHO's work. That was when Dr. Mirta Rosas was the director at PAHO, and she was really interested in bringing this kind of concept across the whole organization. She also had an equity focus and some human rights focus and some other focuses, and that's how she was trying to bring it into the whole organization, was to require everybody to gain knowledge about the different lenses that they had to apply to their work. And some of this got implemented, but things change at PAHO, so it's an ongoing piece of work in progress. I'm now going to talk about health promotion at different levels. So at the individual, family, and primary care level, many people are facing poor access to a variety of determinants of health like education, jobs, water, food, shelter. Plus they're exposed to violence and toxins in the environment, heat, noise, and a lot of these are beyond individual control. But many people also have unhealthy lifestyles. So in health promotion, we've advocated for improving the living and working conditions of those with low socioeconomic status and distributing programs and resources to those most in need. But often the health promoters' social justice and determinants of health upstream work often get overshadowed by a focus on healthy lifestyles and individual behavior change, especially in primary care settings. And I think it's particularly challenging for health promoters who start out with a very strong view that they need to be focusing upstream and on social justice work, and they end up being caught in this work on healthy lifestyles and individual behavior change. Not that that's not important and not that that's not part of health promotion, but it's such a small part when you look at the overall set of strategies that you could use in health promotion. The healthy lifestyles piece is a small piece. However, it tends to be the piece that hijacks the rest of the agenda. I was in Brazil last month in November and working with, or been asked to speak at a conference with primary care practitioners in their primary care system in Brazil. And they have a system that's designed to enable and practice in an entire neighborhood and potentially to do some work on the determinants of health. And they found that they were constantly being drawn into the healthy lifestyles work. And that was a frustration for them, but that's part of what people have to deal with at that level. However, I have an example of Dr. Andrew Pinto's work in the upstream lab at St. Michael's Hospital in Toronto, where he's been trying to build in to the primary care practice at St. Mike's a focus on the social determinants of health. So one thing they've done is develop a survey for patients about the social determinants of health and connected it to their patient record. And then in addition, patients living at or below the poverty line are identified, and then they're referred to an income security health promoter. That's actually the title of the person in that position, who then assists those patients and their families to navigate the complex programs that they're entitled to maximize their access to the existing benefits, and that they get some employment support, they get help completing their income taxes, accessing whatever free services they're entitled to, identifying whether they need subsidized housing and how to get it, and improve their financial literacy. So you can see there's an example of trying to take what's happening at a primary care hospital institution and trying to stretch it a bit so that it really encompasses that more upstream aspect of health promotion. Now I'm going to move on to the community level. How many of you have had a chance to work in healthy settings, at different kinds of healthy settings? So quite a few people have been able to be involved at the healthy communities level. And the next level is the healthy universities level. And then some in healthy schools. Because these are major worldwide movements. The World Health Organization has a healthy schools set of guidelines and a worldwide network, healthy communities and municipalities network, healthy workplaces, healthy hospitals, healthy universities, healthy islands. There's so many of these different healthy settings movements globally. And they're really all about creating health with people within the settings of their everyday life where they learn, work, play, and love. And those settings are defined as their home, their school, their work, their hospital, municipality, and community. The key features of any activity in this official kind of healthy settings movement globally would be that people have to be involved in goal setting within that setting. So if you're in a healthy school, you would be working with the principals, teachers, students, janitorial staff, parents, and the surrounding community, if you're doing it in an ideal way, to focus on what would make that a healthy school, what would create health in that particular setting, engaging all of those people. And you would be focusing on very broad determinants of health, ranging from what kind of air people are exposed to, the playgrounds, the way the classrooms are organized and set up, the kinds of food that's sold in the school or brought into the school, levels of physical activity, any kind of education processes. So there's a whole range of strategies, and in some cases requiring a focus on healthy public policies. So you may need to bring into your school a no smoking policy, or a no junk food policy, or a no soda pop policy, or a physical activity, a daily physical activity policy. I mean, there are lots of ways in which the policy level is engaged, but covering a range of different kinds of issues that you might face in a healthy setting, like a healthy school. Trevor Hancock is one of the originators of the healthy settings movements globally, and for healthy community work, he's advocating that there's a focus on the community, the environment, and the economy, and that all three of those pillars need to be part of any work going on at a healthy community level. This whole concept of healthy settings originated in the health promotion sector and with health promoters, and is carried out globally as part of a health promotion initiative in a range of different countries around the world. And Trevor's work on this kind of a model is shared globally with others who are working in these areas. It's taken very seriously. This is a big example of community work, and very holistic community work, that health promoters are engaged in. One of the projects that I'm currently involved in with Toronto Public Health and funded by the Public Health Agency of Canada is a Healthy by Design project in two tower neighborhoods in Toronto. And this is the idea is that residents of these tower neighborhoods are going to be involved in a process to redesign the built environment around their buildings, hopefully to promote physical activity, healthy eating, and community connections. But this involves a whole lot of partners. We're partnering with the developers and the owners of those buildings, the architects, community architects working in the area, planning department, public health department, community development organizations that are operating in both of those tower neighborhoods, the residents themselves, and all the people that are required to create the licenses for changing the building, changing the landscaping around the buildings, some of the policies that are required in their planning department to help smooth and enable this kind of planning to go on, this kind of resident engaged work to go on. I'm involved as an evaluator in this, and I'm very interested in it as a health promotion activity going on for the next 5 years in Toronto. We have moving up now to the policy level. I've talked about policy connections at the community level, but also there's just work that can take place at a range of different organizations. So have any of you been able to influence policy at an organizational, municipal, provincial, national, or international level? So a lot of you are involved in organizations and working at the organizational level. This could be a range of different organizations, and then some municipal, some provincial, very few at the national level, and some at the international level. So that's interesting. Working in a health promotion way does require us to think about changing conditions of life, and this does require policy changes. And as health promoters, we can either work with governments or work with citizens and NGOs to advocate for policy change. We can work within an organization to make change. Usually we do this by strengthening community action or the participation of residents, more marginalized communities in the discussions. We collaborate with others. We work across sectors. We use something like the Healthy Settings movement. We often write policy, or we end up advocating for policy change. I did want to talk about the global connection for a moment, because I've found in talking with people about having a health promotion career that I think it's inspiring when you're sometimes feel stuck at the level that you're working and that it's not as health promoting as you would like. But just to know that you are connected to people around the globe, where the Ottawa Charter is a guide for practice. I've traveled all over the world, and the Ottawa Charter is recognized in Taiwan, in Indonesia, in Australia, in India, in countries in Africa, in Europe, in Latin America, and all across the Americas. It's a guide for practice, health promotion practice around the world. So that health promotion definition and those 5 strategies are guiding health promotion and health promoters around the world. So when you're practicing this way, you're actually connecting to people around the world who are also practicing or trying to practice this way. And I'm sure you all have common struggles. But there's also a very international level at which we can start thinking about health promotion. So beyond the national level, the country level, but looking internationally, there are interconnections between countries about major issues that are affecting our health, like climate change, or the flow of finances around the world, or infectious diseases and the migrations that are caused by war or climate change or economic conditions. And these interconnections between countries are also expressed by policies that our country has, our trade policies, our immigration policies, our development policies. And there are some health promoting aspects that could be put into these discussions so that they're not always based on an economic considerations. And people are connecting around the world via social media on the kinds of work that they're doing and the kind of health promotion work that they're doing. So there's this really broad level of connection. And at the international level, the Sustainable Development Goals, as they've been expressed, all 17 of those goals are talking about determinants of health. And they're really, if we were able to achieve those internationally, we would be promoting health globally around the world. So I think it's quite an exciting idea to think that at the international level, health promotion is alive and kicking. So just to recap, I've talked a bit about health promotion practice being a kind of lens or a way to practice in any career where you're working with people in a participatory way, and you're building relationships, hopefully with the most disadvantaged people in your area who normally don't get to participate in decisions that affect their health, and engage them in group discussions and talk to them about what is affecting their health, supporting them to bring their ideas to the local council or organization for policy development. Talk to them about the way you're practicing and use some of their ideas to change your practice. Then collaborate with other agencies to bring new information, training, actions to support health. Those are all ways in which we could take that health promotion lens or those 5 hooks and bring them into practice. One of the things that I wanted to talk about is that the Ottawa Charter was 30 years ago, in 1986. So hasn't anything changed? And to a certain extent, those 5 strategies and that definition, despite initial criticisms in the first 10 years after the Ottawa Charter, and people kept saying, oh, this is a stupid definition, this isn't really going to last, they've proven to be really robust. However, when we're thinking about moving into the 21st century and what's required for moving into the 21st century, last year in November 2016, not November 2017, in Shanghai, they had the 9th of those World Health Promotion conferences. The Ottawa Charter was the first, and the 9th was in Shanghai. And in preparation for going to Shanghai, we had the 6th Global Forum for Health Promotion in Charlottetown, PEI, to prepare some statements to go forward to the Shanghai conference. And in this conference, we were talking about what does the Ottawa Charter, what does health promotion look like going forward into the 21st century? So we took the 5 Ottawa Charter strategies and looked at them again and said, well, what is the new spin we need to think about? So the healthy public policy public policy and policy work is still really important, but looking at the governance issues and how decisions are made from local to global levels. And as I said earlier, in terms of the global connection, there are things happening internationally where we really need to resolve some of the issues around how do we govern and how do we make decisions collectively as a group of countries around the world about big issues like climate change. How do we do that? And then supportive environments to multicultural and ecological environments, recognizing that although the supportive environment did include the physical environment as well as the social environment, we need to up the ante on both of those and really think about multicultural and ecological environments as we're moving into the 21st century. Community action has moved to civil society engagement and action, where we're really talking about engaging a range of different NGOs and actors and organizations working in communities at a variety of levels. And from personal skills to community and individual resiliency, and health services to a health and human services system. So it's not just about health services, but connecting to human services, really looking at mental health and physical health all together. So if we looked at promoting health, that previous list that I gave about reaching out and building relationships with the most disadvantaged people in your catchment area, and we put the Charlottetown spin on it, then we would be talking about that, and that's connected to building community and individual resiliency. Supporting local people to work with local NGOs and bring their ideas to local councils. That's about civil society engagement and local governance for health. Using their ideas to change your practice is about reorienting services in different sectors towards creating a health and human services system, and collaborating with other agencies to bring in new information is about creating multicultural and ecological environments to support health and civil society engagement and action. So that's how I was taking the Charlottetown directions and connecting them to the work at the sort of generic kinds of activities that health promoters could do. I'm going to stop there because I said I would stop at 22. What I have in the remaining slides, when you get to see the slide deck, is that there's just an example of applying the same set of actions that I have up in this side about reaching out and engaging people and supporting them using domestic violence as an example.
Thanks, Dr. Jackson. So I've received a couple of questions already.
But I think
the first one comes
from,
and I apologize if I'm massacring people's names, but Ankur, and that is a question around which residential area or micro market of Toronto are the focus areas for the Healthier Communities Health Project. the Healthy Communities Hub.
Okay, so the Healthy Communities Hub is a group at the University of Toronto, headed by Blake Poland, and that group has been engaged in a range of different activities across Toronto, and it's the hub, and I'm part of the hub that is providing the evaluation support to these two tower neighborhoods. So the most specific answer I can give to the question about the neighborhoods in Toronto is that one of them is the Kingston Galloway neighborhood in East
So
Scarborough,
maybe
and the other one is
Ankur
Weston
can chime in.
at Lawrence and
It's
Weston Road in Toronto. They're two, one in the east, one in the west.
it does
Is that
speak to
what the
the
question was
residential
about?
area.
Right. They're both tower neighborhoods that have about 400 families in they've got two towers on the site. They each have two towers, and
So
they've each got
Ankur's just
each
chimed
tower
in to
has
say
about
that
200 residents. So there's about
answers
400,
their question.
not residents, 400
So I
apartments
also have a comment from
in the
Faye
complexes.
who says, thank you for the 21st century wording and engaging the younger population. I was part of the first delegation in the early 1990s that went to China to talk about primary health care. It focused a lot on public health. Thank you for making the info current with current wording. So we also have here a question from Laura, who's asking, when you talked about the health promoter role, you identified context versus process as areas of focus. How often do you see both of these integrated into the role, and where we do, what would you see as one of the challenges?
When we're making changes to social or environmental context, we are actually being successful, I think, as health promoters. So if we're making a neighborhood more friendly for people to use, which is one of the purposes of the Tower Neighborhood Project, that is going to change the way people interact with each other and the way they interact with their environment. And that's changing the focus, but it's also enabling people to engage more in their community and involved in work in their community. So it is also a health promoting activity. The idea, I think, with the public health agency funding is that this may result in increased physical activity, which could lead to better health. So the idea is that you're not just staying in your apartment, but that you're using the space around you to engage in more activities. So changing the context has everything to do with how you interact with your neighborhood and how much you can interact with your neighbors. And so that is a very important component of health promotion.
Versus processing.
The challenge that's versus pros. Yeah, so the process is to engage people and change their environment. Some of the content, and we've argued this, that they need to have some programs linked to the changing the built environment that specific that help people understand how to use it better. So there's a program component that needs to happen from some of the other organizations working in the area, like public health. So public health is involved in changing the landscape, but it's also going to be involved, or a different part of the public health department would be involved in providing some programming around how to use the environment better for physical activity, how to do some different kinds of food activities in that environment, etc. So there is a
Thanks for that. And
programming
do you
content
see,
component, or there should be,
when
as
you do
well
see
as the
that,
process of engagement.
what are some of the challenges that you see?
Um, the part of the challenge is that and it's interesting, I'm just using this as an example in this particular project. A lot of attention has been put on the process and very little on the content at the moment. And in describing what the intervention is that we're actually doing in the neighborhood, the multiple levels of the intervention, a lot of it is process oriented, but there's going to be some content that needs to be incorporated. And it's trying to understand what content programming is already going on in the neighborhood and
Thanks.
what
We have another question
needs
this
to
time
be
from
brought
Ellen,
in.
and
From
she's
an
asking
evaluation
if you
point of
have
view,
an
there's a very
opinion on the
complex number of
certification of health
factors that need to
promoters
be
or the
integrated to understand
registration
what's
as
going
a
on.
profession.
Yeah, that's a really tricky question. I know in the 1990s, I was definitely not in favor of certification of health promoters, but more understanding the integration of health promotion into um, practice. I think the challenge that we're facing now is that, and one of the challenges that happened at PAHO when you integrate health promotion across the organization, you then think, or the organization thinks, that it's done the job, and therefore they do not need a specialist health promoter on staff. And there's no one keeping an eye on how well the organization is doing in actually mainstreaming those health promoting processes into everything that's going on. So by saying that we don't need a specialist, it says that everybody can do health promotion, and that's not strictly true. There's some very specific views and skills that are required. And so then the question is, do we need that kind of certification or registration as a professional? And it would raise the profile a great deal. One of the challenges that I see is that the health education is a certified skill in the United States. So you get certified as a health educator, which restricts generally the practice to being more lifestyle oriented. And I would not, personally would not like to see that happen in Canada in the same way. And I know that the Health Promotion Canada people have been wrestling with what does health promotion certification look like in Canada? What kind of work is involved in doing this? The International Union for Health Promotion Education in Europe has been setting out criteria for certification in Europe on on being a health promoter. Korea has a certification process. I worked with Singapore on a certification process. So there are examples around the world where people have taken a broader approach than the United States to health promotion certification. And there's some value in having this because it does make people think about integrating this particular skill into their organization. At the same time, it would be nice to see more people practicing more of the elements because it's such a broad field of practice.
Maybe one or two
so
questions.
Again, I'm not
we
completely
just have one now from Melissa.
certain about the certification,
so
but
she's
I'm much
asking
more in
if you have
favor of it than I
any
used to be.
specific education you would recommend for a career in health promotion, especially focused on upstream determinants of health, DOH.
There are programs in Canada that are specifically focused on health promotion, undergraduate and graduate programs. Most of the ones that I've seen are focusing on upstream determinants of health. So any kind of those programs, the U of T Masters of Public Health program focuses on those upstream determinants of health. University of Alberta, Dalhousie, UBC, there are a variety of programs that do talk about health promotion in particular, Western Ontario, and they have a focus on upstream determinants of health as well. Any policy work would usually involve that as well, so that those kind of skills would have that. And Morgan's right in terms of Dalhousie. No, it's not the only undergraduate program in health promotion. I thought Western Ontario also has one.
I was wondering if you had any suggestions of events or conferences or knowledge exchange events in the field of health promotion that you can share.
The Canadian Public Health Association is one of the main places where you can get opportunities to exchange information about this. The International Union for Health Promotion Education has a conference every 3 years, an international conference, and that's a really great opportunity to connect with people globally about health promotion, because everybody there will be focused on health promotion only. The next one is in April 2019, a year and a bit from now, and it will be in Rotorua in New Zealand. And it will be focusing on land and the environment, and it's being organized by the Maori there, so it will have a strong Indigenous focus. So Indigenous-oriented health promotion will be a very exciting opportunity for that conference. And in Australia, they've got a Health Promotion Association, and they've got a big conference. In Canada, Health Promotion Canada is usually connecting, as far as I know, with the CPHA conference. So that's our big chance to do that. And as Deborah's noting on her comments, that there's the latest. There's now a 4th book come out for health promotion in Canada, Critical Perspectives. So it's in its 4th edition. That came out in the fall, and it's a new version. There's many new components in it, so it's updated about what's going on in Canada, and it's quite an exciting book, actually. And the National Collaborating Centers are good resources as well. The thing about the IUHPE conference, I know that in 2000, 2001, I was told, oh, health promotion's dead. There's, it's an old concept. It's going to be replaced. There's no real interest in health promotion. And then I went to the IUHPE conference in Melbourne that year in Australia, and there were 3,000 delegates there. And it was just so exciting to hear what was going on in health promotion around the world. And I kept thinking, no, 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 this person in Canada's got it all wrong. Health promotion is not disappearing off the face of the earth, and it hasn't disappeared off the face of the earth. It's still
So I think
exciting,
that's
and
a
there's still
great
components that are,
note to end the
and you can see that
presentation, and
in the Health
I would
Promotion
concur.
Canada
This
Critical
has been our
Perspectives
most
book. You can
popular
see it in the
webinar
conferences
series,
coming up.
so I definitely
It's
don't think
exciting.
it's an indication that health promotion is dead. So thanks again to Dr. Jackson. So on behalf of everyone at the Canadian Public Health Association, we hope this was insightful for everyone who was able to join us today, and that it's helped you better understand what health promotion as a career entails. And like I mentioned earlier, we'll be sharing the slides and the recording at a later date, and they'll be more broadly available to the public in a few months. I received during the presentation a message from Morgan that if you'd like to stay connected with other health promoters across Canada, you can become a member of the Health Promotion Canada. I've just posted a link to their website in the chat box. And if you're not a member of the Canadian Public Health Association, consider joining. Membership is a great way to connect with other public health professionals, and there are many benefits to joining, including many student opportunities like a mentorship program. We have a call open for mentors now, and we'll be launching a call for mentees who want to participate in the program over the next few weeks, so stay tuned for more. I'll post our membership details in the chat box as well. And as part of the student opportunities, we launch a few calls throughout the year for student publication in our Health Digest, our quarterly newsletter, as well as the student blog. So you need to be a member to submit there. And you can start preparing your submissions at any time. We have some instructions on the website that I've just posted in case that interests you. And so that's it for my spiel about the Canadian Public Health Association. I'll thank you again to Dr. Jackson for an insightful presentation, and thanks to everyone for presenting. I hope that you'll be able to join us again next month. The session is a day in the life of a postdoctoral candidate, and the registration for that is already open. You can check the chat box for that link. And finally, if you have a couple minutes to spare, if you could help us out by completing a survey, that really helps us improve our series. And we really appreciate you taking the time to share your feedback. So on that note, I'll leave you, and stay tuned in your emails for the archived version of this presentation. Thanks.
Thanks.
Oh, the survey. You sure can. Your duty is done. I have to figure out my survey, but your work here is done. Oh, that's
Okay.
so thank you again.
Okay, so I guess I can go now, right, Emily?
And,
Okay.
oh, good. I'm glad to hear.
Okay, and the polls worked well. That was good.
Wow.
I liked that, so that was helpful. Okay.
We'll talk soon. Bye.